Joining us now is Michael Artigues, a board-certified pediatrician who practices in Macomb, Mississippi, has been doing so for 27 years and currently serves as the president of the American College of Pediatricians. Michael, thanks for calling in.
Yes, sir. I hope you can hear me. The weather's not great on the road here, and I hope not to be dropped.
Yeah, we got you. So we wanted to talk to you about some legislation that has been introduced in the state Senate concerning gender-affirming treatment for minors in the state of Mississippi. I believe there are 3 bills that have been introduced. What do you know about that, and what, in general, what do you think about what seems to be gaining a great deal of attention and traction in this country, and that's performing this surgery, these gender transition surgeries on minors?
Right. Well, I'm not familiar with all the bills and all the detail. I do know that, like you said, some of them are looking to address specifically minors, and it's a group that is really where most of the controversy is. The studies that they're basing treatment on right now are extremely flimsy and really don't reach the standard of care that we're used to in medicine. And with some things, maybe that wouldn't be as huge of an issue if the outcomes weren't potentially so bad. But we know that with some of the medications and certainly surgeries that are performed, we're talking about life-altering conditions. We're talking about permanent sterilization, things that you just can't step back from. And so we know that other nations and medical societies in those nations have done just that, and they're by no means conservative places. These are countries and nations that have realized, though, that we don't have enough evidence to continue to move forward in that direction with anything other than intensive mental health for these patients. And I think at this point, that's what we're really asking for, hoping for, that we can have some common sense changes, and it starts in our home state.
Do you think that what's being proposed, which I believe includes the revocation of a licensed healthcare provider's credentials, is appropriate if, in fact, they do perform this gender-affirming, these various treatments on a minor, specifically on a minor? Do you think that's appropriate?
And I couldn't hear all of what you said. Was it something about loss of licensure for physicians?
Yeah, I think one of the bills that's being proposed would, in fact, revoke a physician's license if they perform gender treatment on a minor.
Gotcha. Yeah, I mean, again, while it's not something that I'm proposing personally, or our particular organization doesn't have recommendations as for how states are to hopefully keep these laws that they're trying to pass in active and to regulate it. I understand that you have to put some power behind these measures if it's going to have effect. And I think that we're talking a very small minority, of course, of physicians, certainly in this state, but even in other states as well, I believe, who are treating kids like this.
Right.
But again, it has to pack a punch, I guess, in the end, and however they feel like, if indeed the medical boards have other recommendations for it, I'd leave that up to them. But I certainly understand they had to put some teeth behind their measure.
Have you ever treated and seen any pediatric patients in your practice that have either discussed that they maybe experience gender dysphoria and maybe they and their parents are considering gender transition, or any that have, in fact, completed the process?
Well, it's interesting enough. Until recently, I would have probably said no, other than to maybe have heard of some patients who, as adults, had perhaps those particular inclinations and mental health issues. Yeah. But none up until, like I said, recently, where I had a child who felt like that was their condition. The interesting thing is, when I asked how it is they felt like they came about with that, particular term. They used the term transgender. He said Yahoo videos, YouTube videos. And now I'm not making a diagnosis one way or the other as far
Sure.
as, in this case, whether or not this child has a legitimate case of gender dysphoria. It is really for, I think, the mental health clinicians to handle that, and that's indeed what I did, is refer this child on. Of course, the family that was involved was like anyone, would you imagine, was very distraught. This is going to be the case with anyone who's dealing with a child with significant mental health issues. And a majority of the kids who have particularly gender dysphoria, they tend to have other mental health issues as well, diagnosable issues like depression, anxiety. Mm-hmm. So, again, it usually doesn't go all alone. And so that's why I think what I did, what hopefully most pediatricians or physicians would do, is refer them to a mental health expert who can help them with this particular issue.
Sure. Matt Sharp, Senior Counsel and State Government Relations National Director for the Alliance Defending Freedom, has also joined us in the Element Wealth studios. Matt, welcome. Thanks. We were just talking to Dr. Artigues about what seems to be a rather large increase, significant increase in minors undergoing this gender transition surgery. I've actually, Matt, seen a map that shows medical institutions, healthcare institutions, mainly those affiliated with the medical schools, education-affiliated institutions. Seen a map of, like a short 5 years ago, the number of those institutions where you could receive this gender-affirming care relative to today. It's like a dramatic increase. I don't know what the percentage is, but it's like a handful, I believe you could count on one hand, to virtually every state now.
Yeah, I've seen some of that same data, talking about the explosion that we've seen with gender dysphoria, especially, as you mentioned, with young kids, and many raising concern that there's a social contagion element to this. They've talked specifically about when it comes to young high school girls, that you'll see sort of it cluster, that one girl in a school will begin to identify as transgender, and then it spreads. And these young girls, rather than trying to diagnose, like the doctor was talking about, working on any psychological issues, the depression, anxiety, they're immediately being put on this one-way path by these gender clinics that have exploded and that have a real financial interest in pushing kids down this path as well. And so they're pushing kids down this path towards irreversible harm, towards sterility, towards so many other lifelong consequences. And I think that's why it's encouraging to see Mississippi and other states take up this issue and to say, what can we do to protect our minors from these harms?
Yeah, and I've actually seen, we shared some video, some sound here on the program, wasn't so long ago, that Vanderbilt was conducting, I'm sure you're well familiar with this, a seminar. It appeared to me to be conducted by the director of their center that offers this gender care, as they call it, gender-affirming care to minors, and addressing other physicians and healthcare providers. And they, plain as day, as part of the presentation, she discusses how lucrative this is for the university, because it not only is a very expensive undertaking, the one-time surgery, but you need care for life, specialized care, drugs, etc., for life, because you're sort of going against nature here, honestly. And they discuss, this is a pretty good thing. I believe, if I'm not mistaken, that the Tennessee legislature, or if it weren't the governor, has put kind of a halt on that at Vanderbilt. Is that your understanding as well? They've slowed it down, done something.
Yeah, I know that there's been a big outcry about that. Not only that Vanderbilt openly admitted they were doing this on children for financial motives, but even threatening doctors that dared to speak contrary, that dared to warn, to say, wait a second, maybe we ought to take a step back from pushing kids towards these radical medical interventions. And so, yes, I do know there has been efforts in Tennessee, and believe they're also looking at legislation like Mississippi to protect kids in their state.
Yeah, we're up against a break right here. If you guys can hang around, we'll get to more of this and also talk about some of the Title IX issues that need to be addressed as well. We're coming right back in the Element Wealth studios. Please stay with us. This is Matt Sharp, Alliance Defending Freedom, and Dr. Michael Artigues, a practicing pediatrician, are our guests. So we've been talking about this radical gender ideology that is absolutely sweeping the country, and it's taking hold, and it is being injected it seems like, into every aspect of life, of society, Matt. It's not just sort of reserved for the higher ed community where they maybe contemplate issues like this, you discuss them. No, it's more than that. It's extended into the private sector. It's extended into government. And Rhino, our producer here, made the point a couple of weeks ago that it's just a small fragment of the population that seems to be driving every aspect of life. Policy, law, societal norms, they're all accommodating a sliver of the population. They're entitled to some degree the same opportunities, of course, that we all have. They're not entitled to special accommodations, especially if that infringes on others.
That's exactly right. I'll give an example. Anchorage, Alaska. There's a women's shelter there, Downtown Hope Center, that specifically worked with women that were fleeing sexual trafficking and abuse. But the city there told them that they would have to allow a man to come in and sleep in that shelter, a place where he was literally sleeping 3 feet away from some of the other women. There are plenty of other opportunities, plenty of other shelters, but they've got a duty to protect those women, not to undermine their safety, their mental and emotional health. But that's exactly what this ideology does when it's being forced on these organizations that are simply trying to help women and children.
Dr. Artigues, is there perhaps a debate in the medical community about whether or not this is, in fact, a mental issue, or is it a physical issue, or is it just a preference? Because there doesn't seem to be consensus that if a youngster in particular just begins to exhibit the potential of gender dysphoria, that maybe what they need is care to chase the cobwebs out of their brain more than they knew to go get surgery to mutilate their bodies.
You know, I don't think there's any real debate that it's a mental health issue. The debate, of course, is in what's the proper treatment. And the frightening thing here is that the majority of these kids, the vast majority, I'd say, 80 to 90% of them, when allowed to go through puberty, when allowed to reach that stage of their life and to go through those changes, actually no longer have this deep-seated incongruence with their biological sex, which makes you have to really pause as to why we would stop puberty in these kids who, once you do that, no longer have those natural changes. And unfortunately, it ends up being a self-fulfilling prophecy, and they end up moving on towards full wrong sex hormone therapies, et cetera. You know, I don't think it's so much controversial about the fact it's a mental health issue. The controversy is in how you treat it. And it seems like more and more nations, like you said, others are looking at it. They're debating and they're deciding that, no, we need to put a pause on any surgery and even hormones right now for these kids. They need mental health, and they need it more than anybody.
Yeah. So I've even seen situations where schools are educating their teachers, their staff, on gender, this whole gender ideology situation, but more importantly, the opportunity to recommend, and they're encouraging these teachers to recommend puberty blockers to youngsters. I mean, in elementary school. Oh, I saw you doing something one day that looks like you might be thinking about transitioning genders here. You know, you can take these puberty blockers, and then you can make that decision somewhere down the line. They're even teaching them that gender is something that adults made up. There really aren't two binary genders, that it's whatever adults make up. You can be whatever you want. I mean, is this dangerous, Dr. Artigues?
Well, that's the problem. It's something that is very subjective. There's not a test, a blood test, so to speak, that you're going to determine these particular conditions. It's a child who's coming forward saying, "I've got this particular problem." So that's right there, inherent with fraught with the possibility of error. We've already in this country decided that, for right reasons, because the brain is not fully developed, that minors can't do some things that adults can do.
Sure.
They can't drive at certain ages, or drink, or vote, or serve the armed services, whatever it is. And that's because those frontal lobes have not fully developed. They're not able to make the same rational decisions. And it's unfortunate that we're taking something that is so subjective like this and making some potentially permanent changes to minors. Again, we don't take a stand on whether or not adults have the right to do that. We just need to be a lot more cautious with our children.
Especially something that is so permanent in nature. And gosh, it doesn't take much investigation to find case after case of adults who went through this as youngsters, pre-pubescent, and then had this radical surgery or pursued and took puberty blockers, and now they totally regret it. But more importantly, they have health problems for the rest of their lives.
You know, we had, ironically, years ago when this became a little bit more of an issue, and the College of Pediatricians was asked to address it. I had kind of as politics can make strange bedfellows, this particular issue did as well. We had an organization of, I guess the term would be militant, feminist militant lesbians, actually, who had come out and said that we're with you on this issue because quite often they felt like that was them as a young child. And they were frightened that what's going to happen with those girls who, like was mentioned before, through what seems to be pretty obviously a social contagion, such an exponential increase in the numbers here lately, they're going to undergo some surgeries and treatments that would not have happened otherwise. And these women said that's what would happen to us if they were allowed to do it. So, again, it doesn't take everyone on the same political spectrum even to see that this is the problem.
Yeah.
There's a great YouTube video of Bill Maher, who no one I necessarily supported many of his speeches and positions. But when he talked about this transgender issue, he had a lot of common sense, and it's hard for the left to ignore that.
Yeah, totally true. So, Matt, just to be clear, we're talking specifically here, certainly in terms of legislation that our legislature is deliberating, is considering about minors. Once someone is an adult, they've passed the minor age, if they want to go mutilate their bodies, as far as I'm concerned, that's up to you. You're on your own. You're an adult. You make those decisions. You live with the consequences. But as Dr. Artigues points out, when you're a minor, you don't quite have the intellect to make those kinds of decisions, and society needs to protect them.
That's exactly right. Look at our laws. There's a lot of things that the legislature said minors do not have the capacity to consent to, whether it's voting, whether it's buying alcohol, whether it's signing a contract, getting a tattoo, because we know those have consequences and children cannot grasp that. And now when we're starting to talk about these hormones, these surgeries, that not only the sterility, not only the ability to never have a child of your own, but the heart issues, the liver issues, the damage it does to bones, no child can understand this. And so it is very appropriate for the legislature to step in and say, this is one of those many things that we have a duty to protect the children in our state from, to make sure that they're not being coerced or pushed by these financially motivated gender clinics to undergo these, that they're not being pushed by school officials who, like we talked about, are pushing kids down this path. And that's why it's appropriate for the state to step in and take steps to protect minors here in Mississippi.
It's a dang scam is what it is. I'm just going to call it that. But more importantly, our youth, our children, our most precious asset, we're harming them by allowing this to occur. We're harming them. So this would be like a business going out to their stock room and putting a sledgehammer to their inventory. I mean, that's their asset. That's how they sustain. We need our children to be fully formed, fully functioning, have all their faculties to keep society progressing.
Yep, that's exactly right. And that's why when you look at the states that are looking at this, that's what they're motivated by, of what can we do to protect the next generation from these harmful, irreversible procedures.
Gosh, it's just incredible. And if you say anything or speak up about it, good grief, they want to send you to the guillotine.
Yeah, we've got a case, Dr. Alan Josephson. He's a professor at University of Louisville. And several years ago, he spoke out at an event at Heritage Foundation. I was actually on the panel with him, raising the alarms about this. Next thing you know, his job is at risk.
That is unbelievable. No person should lose their source of income, their employment, their livelihood simply because they stood up for children in this particular case. Matt and Dr. Artigues, thanks so much for joining us. You got an event today, right? Tell us about that real quick before
That's
we
right. Got to have a rally here in a couple of hours. Lots of people coming out to support legislatures as they're looking to protect women, children from the harms of gender ideology.
It's at the Mississippi Trade Mart, right?
That's right.
Appreciate you guys joining us, and thanks for your efforts on this very important issue. Appreciate it. See you guys. Thanks.
Certainly.
Coming right back on Midday. Stay with us.